So the beauty was, for the first time in so many years, no pain in my knees. I have had the condition for almost 14 years. It started with my left knee and then proceeded to my right. Previously, if I stood up, I had pain because my work takes me walking, an airport, how to get to a plane.
Patients suffer from severe bilateral end-stage osteoarthritis. Upon seeing him in the first consultation, his knee condition was very bad, mainly because it has been a long-standing problem and his previous treatment didn't yield satisfactory results. On physical examination, he exhibited more than 20 degrees of bilateral knee bowing deformity, and his knees were very stiff that he could only bend them to up to 80 degrees only. Moreover, X-rays showed severe bone loss secondary to the osteoarthritis. All of these problems pose extra challenges and risk to the surgery.
Being stubborn, I tried a variety of treatments, etc. Some worked a little. I ended up with stem cell treatment, which seemed to work and then stopped. The surgery's never really changed in Lord knows how many years. But with the advent of robots, that made sense to me as an engineer, because I understood the critical part is the cutting, the accuracy of cutting. Last Friday, I came here. 5 hours, I think the operation took, Jenny? Yeah.
Times have changed. Do you trust the robotic new technology?
Well, I looked at the robotic technology I can work with. It's AI as well. But when I look at what they need to do, because there are a whole series of x-rays that were taken so that the parts that needed to be made could be accurately made. But at the same token, they use laser pointers to get the correct positions to align the knees. And now I'm just about perfect.
Wow.
Which is why Dr. Chong is so pleased.
Robotic-assisted total knee replacement technology is particularly beneficial for this patient, especially in the context of severe knee deformity. This robotic technology provides a detailed pre-operative analysis and planning tailored to this patient's specific knee condition. We can adjust how much deformity correction we can achieve and arrange additional instrument and implant beforehand to address potential bone defect, which is essential for cases with severe deformity and bone loss. During the surgery, the entire process is monitored by a high-speed camera and assisted by a robotic arm. This allows us to execute the surgical plan with great precision. Moreover, with the aid of the robotic-assisted technology, we can achieve less soft tissue dissection and reduce the blood loss. These two factors can contribute to the decreased post-operative pain and speeding up patient rehabilitation. This is particularly beneficial for older patients who may face extra challenges during rehabilitation.
So what I hear you saying is that the doctor was not offering false hopes.
No, not at all. Not at all, because he showed me other patients, etc. In fact, he only wanted to do one knee. And my heart physician, who's also here, said, "Oh, but you're okay." So I agreed to one knee, but then I thought about it, and I came back and said, "Dr. Chong, both knees." I insisted both knees. Well, if I have to have pain for 6 months, I might as well have it all together.
So as said, this patient condition is particularly challenging due to several factors. First of all, regarding the knee condition, he has severe bilateral bowing deformity and poor range of movement, along with severe bone loss. All these factors pose extra surgical challenges when contemplating total knee replacement surgery. On the other hand, the patient is relatively old and has several medical comorbidities, including heart disease, which increase the overall risk of medical complications such as exacerbation of heart problem during the entire perioperative period. Therefore, during my first consultation with this patient, I suggest considering one side surgery to start with, and then followed by surgery of the other knee. However, patient is quite committed to early rehabilitation and has requested to have one-stage simultaneous bilateral knee surgery in one go. As a result, after a detailed discussion with the patient and assessment by our teams anesthetists, I decided to offer one-stage bilateral robotic-assisted total knee replacement for this patient. This patient's recovery after the surgery has been very satisfactory and is, in fact, similar to that of younger patients undergoing a single knee surgery. Despite the substantial surgical stress associated with this one-stage bilateral surgery, the patient was able to stand up and walk for a few steps as soon as 3 to 4 hours after the surgery, similar to other patients who underwent robotic-assisted knee replacement surgery. By the time of discharge, his walking ability was on par with that of his younger counterparts. Therefore, we are particularly pleased about this patient's recovery outcome.
So I guess if you have to do this all over again, you would do it again.
I would absolutely do it again.
How do you feel about your decision of trusting the Adventist hospital?
I have no problems with trusting Adventist at all. So we use the Adventist hospital as a home from home if we have serious problems.
Yeah.
We manufacture, and my responsibility is manufacturing and the product and quality. So I look at things differently. And when I look at the hospital, the manner, the procedures, etc., they are very professional and they are consistent. So I would highly recommend the hospital also.